a general statement, the reason why we have to consider additional bone and gum, A, would be for just creating enough volume to actually house the implant successfully. In other words, we want at least 1 to 2 millimeters all the way around, circumferentially around the implant. So if the implant is, let's say, 4 millimeters in diameter, we'll need at least 6 or 7 millimeters of bone to place that implant in a predictable manner. So it's basically for implant stability, we need that. But let's just say we have enough bone for stability, but we've lost the gum tissue. The problem is that if the soft tissue that sits around the implant site isn't the right quality and the right quantity of tissue, it can become very, very tender and sensitive and quite irritating for patients. And of course, it's unique to each individual patient. There is no hard and fast rule, but you have to assess the patient, and if the tissue seems to be fairly thin, and you can tell that they're going to have difficulty brushing around this area because it's such fragile tissue, you're much better off to do a soft tissue graft to help with the long-term comfort and stability of the implant. And then, of course, one of the most important reasons for grafting tissue is for aesthetics, especially in the front of the mouth, when it becomes very important to have the tooth look like a natural tooth, even though it isn't. The way that we can make it look natural is if we have enough gum and bone to allow the tooth cut to come out of this gum and bone and emerge from it like it was coming from actually inside that gum tissue rather than being pasted on top and having it look sort of artificial. So trying to increase volume for aesthetics, trying to increase volume for quality and comfort and function and maintainability and hygiene are all reasons why we have to consider the gum and the bone. And it only stands to reason that if you lost a tooth, you're going to lose gum. If you want a nice, predictable restoration, you have to rebuild the tissues that you have lost.
All right. Well, unfortunately, we are out of time. There's such great information. And in upcoming podcasts, we're going to discuss some of the techniques available for bone and soft tissue grafting procedures. I know you're the expert on that, and I look forward to it. And if you, the listener, know someone who would benefit from what we have talked about here today, please go ahead and share this podcast with them. I'm sure that they'll thank you for having shared it and for the knowledge that Dr. Ickert is providing. And you can reach Dr. Ickert at www.ickertdentalimplants.com. That's ickertdentalimplants.com. And of course, you can always reach his office by telephone at 604-881-1381 or call them toll free at 1-866-931-1981. Dr. Ickert, again, thanks so much.
Thanks, Nick. I look forward to talking again soon.
All right, let's do it.
Thanks for listening. At Ickert Dental Implant Center, we are committed to providing you with the very best in modern and advanced dentistry. If you would like more information about dental implants and our extensive range of specialized dentistry services, please call us today at 866-981-1381. That's 866-981-1381. Or visit us on our website at www.ickertdentalimplants.com.
Local stories, local voices. We're localwebradio.fm.